in a good position to keep patients who are unstable, any longer than absolutely necessary.
And in terms of your ability to stabilize somebody here, you've got a broken leg, you can handle that. You've got a heart attack, what do you do?
Well, we do the best we can. That's kind of our motto out here. Keeping in mind we have limited quantities of medications available. We have limited formularies. So oftentimes I'll be on the phone with a doctor in the emergency room and they're like, why don't you try this? I don't have it. Why don't you try this? I don't have that either. So you have to get a little creative and, it's pretty limited. You take a chance when you have a major injury or illness out here.
Well, and you mentioned like a broken leg. Well, we had a few months ago. We had an open fracture of a broken leg. It might seem simple, but you know what? An open fracture, they need to be gone. I mean, they need to be. He needed surgery. So, yeah.
And what did you do in that case, Benita?
We packaged him as best we could. We put him on a boat and sent him to Cove, and it was snowing and it was blowing, and they put him in an orange basket and lifted him onto the dock, and we got him out. But it took mass amounts of morphine to get his pain under control, to put him on a boat ride for that long, and.
If you had a road on a very snowy day, how long would it take to get to Cove?
An hour and a half. And if they needed help with snow removal, I'd say 2 hours. But you'd be a less traumatic way to get there.
When you have to put a patient in an orange basket and they're swinging, from a boat and
You're
on
hoping
top
they
of
don't
that,
blow off.
it is, I've been on enough medevacs to know how scared you are for your patient. When you have them on board of the boat and there's garbage cans flying across the galley and there's cups flying out of the cupboards, and when you're tipping sideways and you're trying not to vomit yourself while you're taking care of your patient, it's very traumatic. When it's blowing 70 miles an hour and you have somebody who you pray is stable enough to make it to Cove, and then when you get there and you're by the dock and you're doing this thing,
Up and down too.
Absolutely.
In and out, up and down.
So
Secretary, I think if we can get Cameron maybe to talk about the medevac with the 4-month-old baby, just because this is part of what Benita's talking about, but it's